We're gonna get started. For those of you who don't know me, I'm Dr. Amanda. I'm a chiropractor from Awaken Chiropractic down the road in Tilton. But today, I'm really excited to be here and talk to you about the thyroid. So, for me, this subject has a personal meaning because almost every female in my family has a thyroid condition. My mom has one, my aunt, both aunts, my sister, my grandmother had one. So their doctors, what they told them was, okay, well, make sure your daughters get checked because most likely they're going to have a thyroid problem at some point in their life. It's just going to be inevitable. And I was like, wow, I don't want that to be the case, right? So it led me to doing a lot of research on the thyroid, just to understand, well, what can I do to keep my thyroid healthy for as long as possible and prevent issues happening with my thyroid. So for those of you who don't know, your thyroid is a gland, and it is in your neck, in the front of your neck. Sits right in here. Yes, right in there. And that thyroid produces a hormone. And so we have multiple different glands throughout our bodies, and they produce these things called hormones, which are basically chemical substances that travel through our bloodstream, go to cells, and activate different proteins that do certain activities. So the thyroid hormone, its main job is to produce our body's or cells' ability to metabolize and have energy, right? So whenever it comes to the most common symptoms of thyroid, most people think of low thyroid and the fact that they feel tired or low energy. And it's because and have increased weight gain because it's affecting their metabolism. That's like the most common thing that people think of. And what I want to talk about today is how your thyroid gland, how there's so many other parts of our body that are intimately connected with it, and that a thyroid problem might not simply just be a thyroid problem. There might be other underlying issues that could be contributing to it, that if we just mask it without digging a little deeper, we might not get to the root cause, and it may be that we never actually get a healthy thyroid, okay? Now, I am gonna draw in a little bit, but not yet, because I'm not gonna put you to it. The most common thyroid condition is hypothyroidism, or low thyroid. There's two different forms. Hypo, which means you're not making enough thyroid hormone, versus hyper, which means your body's making too much thyroid hormone. Which for both of those conditions, either it's called Hashimoto's thyroiditis or Graves' disease. That's the hypo versus hyper. For both of these conditions, there's an autoimmune component, which means an autoimmune condition is basically when your immune system starts to attack itself. So in these conditions, when you have an autoimmune thyroid problem, your immune system sees your thyroid and thinks it's a foreign agent, and so it attacks your thyroid, and that's what contributes to having either low or high thyroid hormone, okay? So if we want to understand if this is our issue, a lot of times when we get our thyroid levels checked, they check two things, or three things technically. Our TSH, which is our thyroid stimulating hormone, and our T3 or T4 levels. Now, in order for us to determine if there's an autoimmune component, there's another blood test that you have to take. And a lot of times what will happen is you'll just get this blood work done. It says you have low thyroid hormone, and so then here's my prescription for a synthetic thyroid. Oh, by the way, you need to be on it for the rest of your life. Right?
No, I'm sorry to say that.
No, they say, here's your prescription for synthetic thyroid hormone, and by the way, you need to be on it for the rest of your life, right? And that's what they tell you. And literally, there's so many things that we can dig deeper on to help us determine, well, is there other aspects that we can do to help our thyroid? And I think that's one of the big things. If you look at the fourth most prescribed medication in the world, it is Levothyroxine, which is thyroid hormone. It is extremely commonly diagnosed, hypothyroidism, very, very common, and especially in our women. And we'll talk about why that's the case too. But we're going to get into some drawing so that you can really understand how the thyroid works. So, we're gonna start, it all starts in, do we know what part of our body is this?
Liver?
It's up top. Here's my eyeball.
Brain.
Yeah, brain. Yeah, good job. Woo! My drawing skills. Okay, so this is your brain. There is a gland in your brain called your pituitary gland, and it creates a hormone called TSH, which is thyroid stimulating hormone. Can you guess what that hormone does? Stimulates your thyroid. You guessed it. Yeah. So then that goes to this little butterfly-shaped gland in your neck called your thyroid, and it stimulates your thyroid to then produce T4, which is one of your thyroid hormones. However, T4 is not the active form of this hormone. This is not, if this T4 goes to your cells, it does not do the job that it needs to do. It has to be activated into T3, which, where does this go? I think you said it earlier. It's a big thing over here. That's your liver. Yeah, that's your liver. I know it doesn't work. Yeah, it doesn't look like it, but that's the liver, right? And then in the liver, this is where 80% of your T4 gets converted into T3, which is the active form of your thyroid hormone. That's what you want, because this then goes to your cells and what causes metabolism. Now, there's another component to this. There's a little bean looking thing over here. It goes in here. And then this thing, it stores bile. Do you know what organ this is?
Pancreas? Gallbladder.
Gallbladder. Good job. Close. Pancreas is over here too. But yes, stores your bile. And bile, the enzyme is needed to convert T4 to T3. So to have healthy thyroid function, not only do you have to have this mechanism working from the brain to the thyroid, but you also have to make sure your liver function is high. Because if your liver is under toxic load, say you're an alcoholic or a drug addict and you have a lot of toxins, because that's what your liver does, it's a detoxification center, it's not going to be able to do this conversion of T4 to T3, right? And then also, if you have low bile production, your liver is what produces bile, your gallbladder stores it, but if your bile production is low, you're not going to get this conversion either. Or if you have any sort of blockage in your bile flow, which could be from gallstones, gallbladder issues, maybe you have your gallbladder removed, things like that, that's going to affect this as well, right? And then, of course, we're going to, oh gosh, this is brutal. You know what's this?
Intestines.
Yeah, good job. Good. Kind of, it's a little wonky, but that's our human. And then, so bile, we need bile not only for this conversion, but it's what allows our body to absorb fats, okay? So there's a lot of things that are created here. So what happens when we get our blood work done is typically our TSH levels, if we have hypothyroidism, are going to be high. And our T3, T4 levels are going to be low. And the reason being is because our brain can sense in the body that we don't have a lot of thyroid hormone. It's like, oh, the levels are low, I got to stimulate my thyroid. So it pushes TSH. It's like, okay, let's stimulate. But for whatever reason, even though the thyroid is being stimulated, it's not producing these hormones. And there's other things that can affect it that's causing this. It's not just because we have low thyroid hormone. Does that make sense? Okay. Now, symptoms or things that people can experience that could be indicators of thyroid issue. The biggest one is going to be fatigue and weight gain in terms of hypothyroidism. That's the most common things that we see, but also brain fog, depression, constipation, hair loss, versus hyperthyroidism. This is weight loss, anxiety, really fast heartbeat, excessive sweating, constipation on this side versus diarrhea on this side, so you can kind of see a little bit of opposites. But both of these signs mean and difficulty sleeping and fatigue are in both categories, okay? The big thing that you're gonna notice is that even with taking a prescription of thyroid hormone, a lot of times these symptoms don't always improve. And the reason is because just throwing T4 or T3 at someone, if there's another underlying part of this mechanism that's not working, it's not going to solve the problem. So again, digging deeper to figure out, well, what other parts of your body maybe aren't working the way that they're supposed to, right? Now, other things to think about. So we talked about the liver. When it comes to the gut connection, if you took my digestive class, we talked about this a lot, but the gut, that what separates your gut, so this is the food we've consumed, it's in our gut, and then this is our blood. What separates the food we eat and our bloodstream is only one cell wall layer thick. So there's not a lot that separates what we eat from our blood. This can become a problem because these cells, they're connected by these tight junctions. So we want those cells to be nice and tight so that, say we're eating food that has toxins, say, you know, there's pesticides on our food for whatever reason, we don't want any of those toxins to enter our bloodstream, right? However, what can happen is if we're not eating proper foods or we don't have good gut health, then those tight junctions get loose, and then bigger particles start to pass through, and we get these big foreign bodies, and that is what will stimulate an autoimmune type reaction in our system. Because our body recognizes that there's a lot of these toxins floating around, and it increases your immune response, and then your immune system starts getting confused between what's actually a foreign body and what's actually your cell. And so it'll start to attack other organs like our thyroid and again create this kind of autoimmune cascade and decrease then thyroid production. So if I'm just giving you thyroid hormone, but I'm not addressing the fact that maybe we have an underlying gut issue and maybe you have an underlying autoimmune issue, well, that's not going to get to the root problem. It's not going to fix anything. It's just going to get to the point where you may need more and more thyroid hormone and they're constantly changing your dosage because this is just so out of your body's control that the medication can't get to the root cause. Make sense? Yeah. The other thing too that's really interesting, because I put on here gluten sensitivity. So how many of you guys know what gluten is? So it's a compound in wheat that we've been more aware of, especially in the last 10, 15 years, especially with celiac disease, which is gluten intolerance, which means that you have a really bad reaction to any of, gluten is the fiber, or the compound protein that's in wheat products. So, and it's also hidden in a lot of our other products that you don't even realize. So when we have a reaction to gluten intolerance, or gluten celiac disease, that's one extreme. That's not the most common. However, the majority of us have some sensitivity to gluten, because what happens when we eat a lot of gluten is it attacks these tight junctions and makes them more loose. And it's a big contributor to these autoimmune type conditions. And if we get large toxin gluten type particles, our body, what it does, our immune system creates what's called an antibody to this toxin, right? So that it can fight it. And the antibody that it creates for gluten, interestingly enough, is it matches the thyroid hormone receptor. So if we have a high gluten intolerance, a lot of these gluten particles that are passing into our bloodstream, our bodies are making a lot of these antibodies, and not only does it attack gluten, it also attacks our thyroid. So when it comes to anyone who has been diagnosed with a thyroid condition, making sure they're avoiding gluten is huge, 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 huge. And it's so funny because we know the pharmaceutical companies haven't done the research on this because, interestingly enough, some of the thyroid hormone that's on the market, the pharmaceuticals, the synthetic thyroid, guess what it contains? Gluten. So someone who's clearly dealing with a reaction to gluten, most likely, and then you're going to give them something that contains gluten. Yeah, so that's another big contributor to thyroid issues. Another thing, because I mentioned, we talked about, so that's the leaky gut, but we talked about females and how females have a higher instances of thyroid issues. The reason being is because of our female sex hormone, estrogen. When it comes to estrogen, if we have too high of estrogen levels, estrogen binds to our thyroid receptors and prevents this down the line T4, T3 chemical reaction. And unfortunately, there's a lot of exogenous estrogens that we deal with every day, which is estrogen that we get from outside of our body. Exogenous is outside of, versus endogenous is what we create internally. The exogenous estrogens are from anything from the food products that we eat, like a lot of dairy products. We get a lot of foreign estrogen from that. And then also our female hygiene products. So our shampoos, our conditioners, our face cream, there's a lot of chemicals in that actually act like estrogen in the body and create this estrogen imbalance, which will then affect our thyroid hormone's ability to create more thyroid hormone. It's very, very interesting. And this is why a lot of times when people are diagnosed with thyroid conditions, it's pretty soon after either one of their first or second pregnancies. It can be really common because after we deliver a baby, what happens is our estrogen to progesterone balance, our estrogen skyrockets because our progesterone drops because we're no longer maintaining the pregnancy, and that leads to our body's attacking of that or blocking of that thyroid gland's ability to create thyroid hormone. So especially for any moms that you know that are having children, after they have children, being aware of that estrogen dominance and how it can affect their thyroid gland and making sure that they're doing a lot of things to keep their thyroid healthy, like avoiding gluten, for example, because otherwise they may be more likely to be diagnosed with hypothyroid problems. Does that make sense? Yeah. Now, toxins. We talked about that and the fact that your liver is so important for your thyroid health. So if you have too much, if your liver is getting bombarded with toxins from the food we're eating or chemicals or smoking or whatever it is, alcohol consumption, then it's not going to be able to do this job of converting that T4 into that active form of T3. Okay, because that's a big job that it has to do. And if it's so exhausted from doing everything else, it's going to let this go by the wayside. Okay. Now, this is very interesting. Stress. No one has stress. No, do you guys know what that is? Stress. No, there's never any stress. So your stress produces a hormone, all about hormones today, called cortisol. Have we heard of cortisol? This is your stress hormone. And when we have high stress, we get high cortisol. And you know what cortisol also binds to, similar to estrogen? Your thyroid receptors. So, but has anyone who's ever been diagnosed with thyroid problems, have they ever asked about your stress? No. But one of the tests that they should always do before you get diagnosed with a thyroid problem is a cortisol level test. Because if your cortisol is high, well, no wonder your thyroid hormone is low, because your thyroid can't produce thyroid hormone because your cortisol is blocking this reaction. This is your cortisol, blocking it. that we have to monitor, and if they're too high, then if I just throw T4 at your system, this is still, my thyroid is just going to completely shut down and stop working. Okay? Now, any questions about any of this? No? Makes sense? Yeah. Now, let's see. We're going to talk about, got some minutes left. So, other things, nutrient levels are important. Vitamin D is needed to convert for T3 to function at the cellular level, so our vitamin D levels are important. Zinc is required to make thyroid hormone. Selenium, iodine, also necessary for that synthesis of thyroid hormone. Magnesium, if you have low magnesium levels, it increases that antibody production that we talked about over there, that autoimmune reaction. So having appropriate magnesium levels is really, really important. When it comes to testing your thyroid, like I said, a lot of times when you just go to your doctors and they're doing a basic thyroid test, they measure the top, those first three, TSH, T4, and T3. That's it. And then if your TSH is high, your thyroid stimulating hormone is high, and then your T3 or T4 are low, bam, bam, you got a thyroid problem, hypothyroidism. Here, take this synthetic thyroid hormone, you're fixed, right? Now, you should always ask the question, why? Well, why? Why is my T3 level low, right? Why is TSH high? And what'll give you more information is getting these tests done, which is your thyroid antibodies. So asking to have those done in addition, because if those are high, then you know, well, I have an autoimmune type reaction. If I have an autoimmune type reaction, then maybe there's something going on in my gut that's causing this, right? The other things you want to also do is get your stress levels test. This is a salivary test, your cortisol levels, because if those are high, in women, if you're in childbearing years, having hormone tests can be helpful to see if your estrogen levels are high. But even as you get older and our estrogen can drop, our endogenous estrogen will drop, it doesn't mean that you still couldn't be exposed to a lot of high exogenous estrogens, like I talked about, from the chemicals that you're getting in your diet to your beauty products, sunscreens, and things like that. Even like chemicals, sprays and stuff that we use in our house as cleaners. The things to look for on the backs of those labels that are going to tell you if they have exogenous estrogen is parabens and phthalates, PHALATES. Those two, if you see those words on the back of any of your beauty products or your cleaning products, throw them out because those chemicals are going to affect your hormone levels, okay? And then nutrient levels, like we talked about, magnesium, zinc, vitamin D, selenium, iodine. There's all tests for that. So digging a little deeper than just, am I not producing enough thyroid hormone, okay? Now, things you want to avoid, especially food, like we talked about with diet, we talked about gluten being the big one. Dairy is another big one because that's a really big form of exogenous estrogens from our dairy products. They do have a lot of estrogens in your milk and your yogurts and cheese and things like that. Sugar, the reason why sugar is so detrimental is because sugar kills our gut microbiome. So this single layer of cells that protects your food from your blood is guarded by warriors. And these warriors are bacteria. And they live here and they protect these tight junctions. But what happens when we eat a lot of sugar is sugar kills these puppies. And when that happens, you have more instances of getting those tight junctions to get looser, and toxins are more likely to pass through that cell wall. So we want to make sure that we don't want these bacteria to be healthy. And we've all been trained that bacteria is bad, bad, bad. But when it comes to our gut, these guys are good, good, good. Okay? So in refined flour, that's going to affect our gut wall too. And then tap water. Why? We're going to tap water. Why? because tap water contains chlorine and fluoride. And chlorine and fluoride mimic iodine. And they will affect your iodine and your thyroid hormone production because it will stimulate the thyroid and block that iodine from binding in that synthesis reaction. Yes.
When you say tap water, are you talking more city water?
Yes, so
Okay.
city water, well water, you can get your well water tested and see if it has high levels of chlorine and fluoride. But yeah, usually around here we're not. It's when we go to cities that and you can taste it. Like and it depends on where you are too, because there are even like in Belmont, I know I've gone to a couple of restaurants and you can kind of taste the chlorine in the water and okay, this is probably chlorinated because they do have different chlorinations and sanitation things that they do to water. So if you have a well or if you can get like a reverse osmosis filter, if you're on city water, that can be really helpful to make sure that you're not getting those chemicals. But that's a big one, okay? Now, good. So, when it comes to anything regarding our health, the key takeaway is always to ask questions. Not be afraid to ask the question why. I think we've been taught, like my whole life, I remember growing up and I had, stomach issues and you look at your doctors and you think that they're gonna have all the answers. And you take everything that they say as like gold, right? And not saying that every we all want what's best for our patients, the majority of us, and a lot of times we just don't know. When it comes to the gluten contained in thyroid medication, is that out of malice? No, probably not. It's just they don't know, and then it gets put into there, and then it's going to be at the detriment of our patients. And so, as a patient, knowing that no one's going to care as much about your health as you do, and not being afraid to ask the questions, to dig deeper, to get a second opinion, to do your own research, and if your doctor gets upset because you're asking questions like why or can we do more blood work, well, then they might not be the right doctor for you, and that's okay. But always knowing that you have the right to dig deeper, and you have the right to be the main authority on your health, especially when it comes to issues like your thyroid hormone, because like I said, a thyroid problem is not simply a thyroid problem. It's usually a systemic problem. That's whether it's coming from the gut or the liver, the gallbladder. There's so many other things, hormones for us females, there are so many other things that can affect it. And if we're not digging deeper and asking those questions why, we're just gonna mask it, and putting a Band-Aid over this, well, it's not gonna be long lasting. And those symptoms, especially for us females, of hair loss and low energy and weight gain, it can be so detrimental, especially as we get older, if we're not, really understanding why that's happening in the first place, okay? Any questions about anything we talked about? I know yes?
What if we no longer have a gallbladder?
Oh, that's a good question. So if you no longer have a gallbladder, my recommendation is you can actually get a supplement for bile salts. So it helps make sure that you still have high levels of bile salt. And obviously you need to be, mindful of the fat that you consume as well. But yes, you can take a supplement of bile salts, which is helpful. Yep.
Is that a prescription or over the counter?
No, you can get it over the counter. There's a company called Standard Process that I would recommend. I know that their supplements are very high end. When it comes to supplement companies, as you know, you have to be kind of careful. They're not all created equal. But Standard Process, you can look up bile salts. Yeah.
Bile, S-A-L-T?
B-I-L-E, salts, S-A-L-T. Yep. Mm-hmm.
Okay.
And then the other thing too, I'll mention, if you have, because I've had patients that ask this question, if you do have a low thyroid and you're currently on thyroid medication, watching this class, my recommendation is not to go home and throw out your medication. Do not do that, because then you will not be happy with me. Because what happens is if we've been taking that for long term, our body no longer produces T4 at all. Our thyroid just does not produce it. So if you just throw that medication out right now, it will not be to your benefit. Typically what I recommend if someone is on thyroid hormone currently, synthetic thyroid hormone, is they do all the things I talked about, like being mindful of your gut, avoiding sugar, avoiding gluten, making sure you're, being good to your liver, your gallbladder. Do all of those things, and slowly you may notice you need less of that hormone. You may get more checks in there, and that can slowly help you decrease the amount that you need to take. And I have had a couple patients who've gone off of it completely, but it's not a process that I would do on my own. I'd recommend getting like a naturopath or someone who can monitor your blood levels for you, so that you can. But it's not easy. It'll take work, but you can do it.
So is there gluten in all thyroid medicine?
Not in all thyroid
Like
medicine.
tyrosine and
So
Central?
I'm not sure off the top of my head which one contain it and which one don't. But I know I imagine it. I know there's some articles on it. You could probably Google it, but I'm not. What was the one that you said?
Tyrosine and this one is, I think it's like Nitro or
Natural.
something like that.
I know. I don't know if it's Thyroid that has it or.
Yes, Levothyroxine is one.
Yeah.
Armor thyroid.
Yeah, I don't know that one off the top of my head.
Like big.
Yeah, the pig
Thyroid.
thyroid. Yeah, no, I'm not. I don't know.
Okay.
So you have to look into it. Yep, good question. Good. Any other questions? No. So we're gonna do a raffle.